Hey everyone, it's Dr. Rick. So this is a fitness center to a place I'm visiting in Dallas. I wanted to show you what I suggest everybody do as far as strength training. I just did a video on zone training, and that's mostly cardiovascular, but it is important to improve mitochondrial fitness as far as cardio. The other thing that you should keep in mind is that as we age, you'll have muscle atrophy, and if you do cardio, that's great. Cardiovascular fitness decreases the blood pressure, decreases your heart rate, might help with heart rate variability, in addition to fixing mitochondria to work essentially till you die at 100. But it is important, as you might or might not admit to have muscle. So the more muscle I see in my patients, the better off they are as far as independence. That means holding things up above your head, carrying things on the plane, carrying your grandkids or great-grandkids, or just getting off the floor. So it is important to have strength training. But in the tough schedule of trying to fit the cardio in 150 minutes, and 80% of that will be zone 2, 20% of that will be zone 5, you got to do something with strength. And I think everybody's intimidated. These are weights, and they're huge weights. This is called a power rack. They have a bunch of other machines, and these universal type machines are important. They're easy to use. I think the cardio, we already talked about that with the last video, but those are kettlebells. So let's discuss what we are supposed to be doing and how to do it. This is called the back squat, good for core, low back, legs, and upper back. And you can transition into heavier weights, but don't start out with what I'm using. Start out with no weights at all. This is something called the clean and press, where you start out like a deadlift, bring it up from the ground, and then pressing it overhead. Legs, core, upper back, and shoulders. This is a pull-up with leg extended. You don't have to do that, but it engages more of a core and works on your back. The deadlift does work in the same way as the clean and press, but you can handle more weight. Low back, legs. I don't like doing bench press. This is my equivalent. Elbows in, push-ups, still develops the pectoralis muscles and core. This is one arm rows, specifically for lats and rhomboids and the shoulders. And then I finish off with shoulders. That's the middle deltoid. And then the rear deltoid. That's the three muscles of the shoulder, and then the front deltoid, arms and shoulders and trapezius muscles. Okay, so the bottom line with trying to optimize your exercise is to not only have the muscle and strength that usually comes with free weights or resistance machines, but it's also to have a balance of cardiovascular fitness, like in my zone training video, and calming practice. So I think there's three basic types of exercise. There's strength training, there's cardiovascular fitness, and there's the calming exercises, Tai Chi, yoga, Pilates. All those things combined together make a well-rounded patient and human. I think the ideal is to have some functionality. Being able to get off the floor if you fall down is important. You might think, oh, I can get off the floor, but as you get older, it's slower and slower. And also the balance that some of my muscle heads will display is poor. As you get older, you might have big muscle thickness, but what happens when you trip and you break a hip? And yes, you can still break a hip even with good muscle. So it's important to have the balance. All those things combined are important. And I've found that when I say, what do you do for exercise? The default is usually doing what people learned in high school or college. That's a very small window. So I think it's important to just embrace, even if you hate weight training or if you hate cardio or if you hate yoga, to embrace tasting it a little bit. And maybe we can formulate how to work it into your exercise routine or your weekly volume of exercise, which I expect you to do. Please refer to my old video on zone training. Today would be how to embrace strength training as far as compound movements. And you don't have to use the weight that you use in the video. If you can at least start with some of the movements, just no weights, just some of the movements that I deploy, I think that will launch you into some form of strength training. And if you're older, please be patient. You might look apprehensive when you're in the gym and you're not moving any weights, you're just going through the movement, but don't worry about what everybody else is thinking. Let go of that. I think that's one of the problems with the gym, is that a lot of people observing. Hopefully you might get some suggestions from other people that are there, but
And the volume is supposed to be the amount of time. So 150 minutes is important for the cardiovascular fitness part. However, I still expect strength training or hypertrophy training at least twice a week, 30 minutes to 45 minutes. And you don't have to get to the point where you're huge. The idea is just to go through the movement, not hurt yourself, and continue deploying that until you see results. But the experience is to add it to your regime and then fine tune it. If you don't know what you're doing, or if you have pain that really flares you up and keeps you in pain for a week or two, then you have to get to physical therapy. That's where I would probably suggest we use somebody or a center that I trust, because ultimately you can take all the medicines, have all the procedures in the world, and control the disease process, but it's up to you, my patients, to figure out how to maximize or optimize your nutrition, your calming practice, your exercise, so that you will be able to avail of being old but independent. Those things called the blue zones, those cities in the world where you see a conglomeration or a high concentration of elderly that have made it to 100. But I think it's important to have the ideas of balancing the exercise routine, whether it's going to be improving your cardiovascular fitness or your calming practice, increasing your power and strength, developing compound movements. That doesn't mean you have to be a bodybuilder, but the more muscle mass you have, the lower your cholesterol can drop, the lower your glucose can drop. So those of you with high cholesterol or diabetes or pre-diabetes or insulin resistance, use muscle the way that it should be done for making you get to 100 and also be independent. Please try to consider the strength training that I just showed you. Now, if you can take care of the deficiencies that you might have in exercise or routine fitness, I think it makes you a well-rounded patient and maybe a better client.